Ladies and gentlemen, boys and girls, Dr. Larry Burchett, welcome to the Daily Corona series. We have such a great guest here today, Susie Zinn, who is an adult and adolescent therapist with expertise in eating disorders and trauma. Susie, thanks for being available for this, to have this conversation
Thanks,
with me.
Larry.
I think this is a great, so we're doing a Skype interview. We're going to kind of record this and release that. And we're also going to interact a little bit on Instagram. We've got an Instagram live here. So hang tight. We're going to cover some subjects and we'll bounce up for some questions. Um, I want to start with you have a lot of experience in trauma going back to September 11th, both as a person and a practitioner. And,
hmm
now with coronavirus, we're at this time where things are getting intense and scary in New York City with a lot of cases and a lot of deaths. I kind of want you to talk a
hmm
little bit about that, not only for the people in New York, I know you have a lot of friends there, but then those of us all throughout the rest of the country and California that are wondering, is that going to be our fate? Like, there's some anxiety and fear about this whole thing going on.
Yeah. I think it's such a great question. The one amazing thing about New York City as being a New Yorker and gone through 9/11 is that the people there are incredibly resilient. They are in great care and leadership with Cuomo. Now more than ever, people are really looking to their leaders to make good decisions, to protect healthcare workers, to inform their public, to keep their children safe, to keep the elderly healthy. And I feel the contact that I'm having with people there are really communicating strongly that with Cuomo, they feel like he's doing an amazing job to really be addressing the issues that are so needed at this point and to be a leader in the country, just like they did in 9/11, of just really spearheading how the country begins to heal. How do we come together? How do we find post traumatic growth? How do we find meaning making from all of this, even when there's horrible things and trauma that's happening to people? So again, New York is stepping up like it always does, which I think is really important.
Well, there was so many things that you said in there. That the first one is finding comfort and trust in the leadership there, in the governor and the whole system. And although it's not perfect, and in the middle of a lot of news and media, and I see some doctors that are scared, and a lot of this stuff,
Mhm.
and it kind of makes me frightened. But it sounds like you have a lot of kind of trust and faith in what's going on there, and that comforts people.
Yeah, I mean, I think, as I said again, like New Yorkers always lead, and they're leading by example. Unfortunately, having to be sort of because of the density of the city, having to address it differently than a lot of places in the United States, and just in California, we have a lot more room here that we're not living on top of each other, and people are
Yeah.
also not struggling the same way. You're not worried about getting in your elevator and whether or not you're going to be infected the way you are in New York City. We have really different stresses here than they do there. And the community has to come together and figure out how to work together collectively in order to heal, to keep people healthy, to keep this pandemic at bay as much as possible, to reduce the numbers, to flatten the curve.
What do you say? I'm thinking about your friends or family and people in New York who are in the middle of this. What else do you say to them? I mean, what else really helps them to get through this challenging time right now, which may go on for weeks? We don't know how long.
Yeah. The one well, there's several things that I think that people are really doing right now. Is number one is the importance of community. There's all these sort of virtual groups. We even have a virtual cocktail hour with my friends at this point. That there's numerous people sort of part of that. That all we do is send humorous jokes back and forth. That just to kind of allow for a moment of joy in people's lives, a moment of lightness, and a moment of levity. That they're not dealing with. what do I have to prepare for? What do I have to take action for? What do I need to do in order to keep my family, my community, and my friends safe? And
Hmm.
so just those simple moments are so important to people. And and you've really got to make sure that we're kind of adding that positivity on top of positivity throughout the day, which is really important.
How do you balance being realistic and not, I don't know, blowing off the reality of the situation with, I mean, that what you're talking about makes sense to me. Social connections and still kind of, as much as you can, getting into moments so that you forget about, you know,
Hmm.
some of the stress and everything that's going around with that. How do you balance that with kind of a realistic, not foolish look at what's going on?
Yeah. The importance is being informed and having credible information that you're able to take action and to create plans. What happens is, and what we're seeing, especially with a younger demographic, is that they go to Twitter for their news sources and they're looking at
Mm-hmm.
every conspiracy theory or information that's out there as being truth and spreading it. However,
Ah.
we really need to be conscious citizens and to be looking for credible news sources like the World Health Organization. We need to be looking at the CDC. There's other people like Jessica Yellen, I think, is doing an amazing job just kind of doing these small bites of what's happening in the news on a daily basis to keep us informed versus feeling like we have to consume so much information in order to really try to figure out what's what. But we have to actually do a good job of really finding those resources in order to sort of make sound and educated decisions in order we're making them from our prefrontal cortex and we're not making them from a fear-based perspective or that we're being reactive to something that actually isn't true, that isn't valid, that we don't need to get hyper aroused about.
I feel like so many of us are in this hyper arousal state, just kind of feeling constantly stressed in this time.
Mhm.
It listening to what you're saying about, especially a younger generation turning to social media with less credible, you know, reliable sources of news, and how viral stuff that propagates often propagates more the less true it is and the more conspiracy kind of crazy whatever it is. um, how we've you and I were talking about this a little bit. How do different generations experience this?
Yeah, it's actually really interesting. I mean, you feel like the older generation should be the one that's in most fear, simply because the fact is that they are at the highest risk from what we understand today. That may or may not be true in the future as the medical community knows more and more about it. But at this point, that is sort of what we're saying is people that have immune issues, people with heart issues, people that are elderly, that this is the most concern about keeping their environment safe and clean in order to not be infected with coronavirus. However, they also have the most resiliency. They have been through things. If you
Mm-hmm.
talk to someone who's experienced wartime or experienced their families, that they've heard about the depression or they've heard about various things throughout time, that they have a context of what it means to survive and to thrive. And they can look at the situation as, while it's not something that any of us have ever experienced, especially on a global scale, we can have a perspective that we
Mm-hmm.
will get through this and we'll figure out a solution and we will get to the other side of it. Versus a younger generation, especially like a teenager who has not even been through 9/11, it's difficult for them to understand what uncertainty means. And the fear base is so much more extreme, and the anxiety
Mm-hmm.
for them is so much more extreme because they don't have context from it. Um, I'm also seeing, that people that are in their 30s and 40s really worrying about their elderly parents. How are they going to take care of them when they're far away, that they
Yeah.
can't get to them? There was a terrible story about a family here in the States with their father who passed away in Italy and not even being able to have the ceremony and ritual of loss together as a family based on this.
Mm-hmm.
That separation, what that does for a different generation, and how
Mm-hmm.
much that trauma becomes so much more impactful and has a bigger impact on the entire family because of that. 20 somethings who are trying to take care of their friends, but not really taking care of themselves and trying to find how they put their own oxygen mask on if they're trying to put on their friends so much, and needing their parents to really guide them. There's so many various things, even teenagers with kind of having this close quarters of lack of privacy and lack of relationships and friendships, and having maybe family dynamics that are going on with, what's being reported as increased turmoil of relationships, as this is kind of highlighting issues that may have already been existing in family dynamics prior, but just putting more attention on them now and causing more stress and strain in the home.
There's so many different things to think about in different generations. Just to echo from the doctor side, it's absolutely risk factors for getting into trouble with coronavirus when you get it goes up with age, for sure. We know that for sure. The older you are, especially over 70, 80, 90, and with more medical conditions, heart disease, lung disease, the more likely you are to get into trouble when you get coronavirus. But I like hearing that the elders have a resilience, they've survived, and kind of a confidence to look at this from a long-term perspective. Um, that was a great generation that served in World War II, for example. Those guys are
Mm.
in their 90s. I don't have a ton of those patients left, but having lived through some of those things, those are people to lean on, grandma and grandpa and parents, and getting their perspective and talking to them and talking things through them. I bet there's some wisdom and kind of calm confidence that could help some of us in the younger generation who haven't been through this kind of stuff.
Yeah, I actually even just spoke to someone the other day who they had a conversation with their mother, and she talked about being on bed rest because the person was a twin, and her mother was on bed rest for 7 months and in isolation.
Wow.
So the fact is that her mom sort of sharing, what, this is difficult, this is challenging, but it's not the same. But I've been through an experience that I have information that can be helpful, and that allow that person to really have a lot of comfort of saying, what, I get this, I understand can be a different way of looking at it, but there's tremendous amount of comfort. And it's exactly what you're saying is talking to your elders, hearing the stories. I don't know about you, but I'm hearing more and more people getting on ancestry.com to be kind of reading about their families because we have this time. I even heard on Carson Daly on today, he just had a baby and he was talking about exploring his Irish roots, and that's how his daughter got her name today. Versus we might not have had that same time or experience or ability because of this sort of unique situation we are in this point, and how important those things become to us in times like this.
Let me ask you kind of a little bit segue of a question, but what advice would you give to parents of millennials, children that are younger, in terms of, what do you tell your kids during this time? How do you meet their needs? Like, what do you look for in your children?
Yeah, I think it's a great question. And the number one thing is we have to lead by example. If we are spiraling out of control, if we're in a panic, if we're struggling with anxiety and depression, we're not getting up, we're not brushing our teeth, we're wearing the same clothes the day that we slept in, we're not eating properly, we're not on a schedule, we're not exercising, we're not connecting with our friends, and we're just staying stuck watching news all day. How is that possibly going to be helping our children? Most of them are going to be on spring break here if they're not already, where they really lack structure and routines. And it really is up to the parents to create a routine. And that is as specific as we get up and eat breakfast. We get up, we brush our teeth, we get up, we take care of ourselves and get dressed, even if we're not leaving the home, even if you're in New York City and you're not leaving the home. We're still getting up and doing things that are normal in order to kind of create more balance and mental health wellness within the family. And then also kind of going to the importance, as we talked before, is finding joy, making sure that there's things that are fun. I'm loving the TikTok videos right now that are going on with families that they're coming together and creating these crazy videos. They're hilarious.
Mm-hmm.
They're having fun together. They're doing family Yahtzees. They're doing board games. They're connecting in different ways than they have. And again, we have this sort of privilege of time that for some families, this is an incredibly special moment for them to really be together, and to know that they're all healthy and safe, and how special that is. So really taking advantage of that, whatever that looks like.
Give me some more examples of routine things. I know you said kind of get up, get breakfast. I like to make my bed after I get up. Gives me a sense of control over my immediate environment. Or going to
Keeping your
exercise.
house clean.
Yeah, right. So what other kind of
Uh-huh.
routines are helpful in this time?
Right. I think that one of the really great ways is sort of, I really feel it's super important is that there's no media, there's no blue lights for 30 minutes when you're getting up first thing in the morning. Because if you're getting up in a calm state and all of a sudden you're joining it with the news, and all of a sudden you're joining it with your being bombarded with emails, your nervous system is going to be jacked, and you're setting up that for the day of how you're going to feel. If you get to decide how you want to feel throughout the day. So if you get up and you stretch, you eat breakfast, you take a shower, you hug your family or your dog or whoever's there, or you connect with someone in some way, and you're choosing how you're going to set your day up, really brings down your nervous system, gives you a lot more sense of agency and control, allows you to feel more grounded. I even I'm recommending to clients is like, let's journal about that. Like, how do you want to feel today? What do you want to accomplish? What are your important goals? And what are the things that you can they'd be nice if you sort of get to? And that way we can kind of say, hey, this is what I have to get to today. These are the things that I can let pass. And really important in that is actually making sure, again, that we're adding joy, we're adding self-care, we're adding connection, in this isolation and social distancing, that we really need to make sure that we create space and time within our schedule for those things. And then I oftentimes just even doing a check-in at lunchtime. Again, this is a schedule. We're eating lunch at a regular
Mm-hmm.
time, and we're checking in. Hey, how's my day going? Do I need to bring up the energy? Have I done too much self-care that day? And I've just been watching Netflix and, for the past 4 hours and I haven't done much. Okay, what do I need to shift right now?
Mm-hmm.
Or, have I been like cranking it and I've had no connection and I'm sort of in the zone and I haven't even checked in how I'm feeling. So, maybe I need to kind of pull back a little bit and give myself some reprieve and time to relax, to check in with myself, to check in with others. And just sort of adjusting your day that way accordingly. And then at the end of the day, where was I successful? You just got to keep, and that may be hour by hour, that may be every couple of hours, but I think it's really, let's set it up from success from the beginning of the day.
Tell me again. I wanted to. We're in the middle of this interview, and you're like saying this stuff, and I'm like wanting to take notes for my own personal. I was like, like the things I need to get done today, and this would be, and then tell me again what you would recommend journal wise at the beginning of the day. I just want to repeat that.
Yeah. So I think it's really important to, first of all, get up and for you to decide, how do you want to feel today? You're doing a body check-in. You're like a little tight in your body and your shoulders, and you're noticing there's some tension. All right, let's kind of release that. Can we actually stretch? Can we allow our body to sort of relax a little bit into it? And then I'm setting my intention of how I want to feel.
Yeah.
Right. I'm actually choosing that. We know that we have the control and power to do that. We have 60,000 thoughts a day. And if we choose to ruminate on one, that's up to us. Right. But for us to actually really decide on what type of intention we want to have for the day. And then separately setting your goals and what you want to accomplish, what is important, what is imperative, what's on that list that has to be done. And then there may be a quadrant for, all right, that these are pretty important, but if they shift till tomorrow, that's okay too, because we know we can adjust that tomorrow. If those things are not done, we can move those to the top of the list for the next day. And then it may be, these are things that are nice, like, because what we don't want to get into is this project in this time that were like, you know what? I need to reorganize my entire video log. And I'm going to spend the next week doing that. But then everything I need to take care of that in the immediacy, and I'm not doing my self care. I'm not connecting with people. I'm not getting
Oh,
exercise. I'm not doing what I need to get done. And as a result, it's going to cause me more anxiety and depression.
it's so funny to. I'm just like listening to what you're saying, and I'm like, oh my god, like I could benefit on every single thing that you're saying. And I sometimes I get so easily distracted, and I've got a lot of things to do, and I'm farting around, and what I, like so yesterday, this might have been. Remember if this? No, this was 2 days ago. I'm running around, I'm doing these videos, I'm doing too much. Like, I needed a break. I needed a mental break to engage in something else. And I saw it's this. I'm going to show you this. Okay, it's this
Okay.
couch that I'm sitting on right now. Okay, and this couch has been sitting in the garage. I don't know, for like a week or two. So of course, in the middle of this time when I'm really busy, I see the couch. I walk by it and I'm like, I'm gonna put that bad boy in the basement today. Like all I needed to do is create another project in the middle of a busy
Yeah.
day, and it's like I was that guy in that cartoon Up. Like with that
Yeah.
dog, he would say squirrel, and he'd just go off and chase the squirrel. Like that was me with the couch, and then there went like an hour of me shoving the couch down the stairs and moving the other thing. I'm actually very happy now that I have the couch here, and it was an enjoyable watching the Hunger Games 4 on it last night. So I'm glad I did that. It was and I think looking back, like I just needed to stop reading on coronavirus news and change it up and
Hmm.
do something different. But it totally wrecked my afternoon, the way that I did. So I really like a lot of your suggestions about how, people can practically integrate this stuff and be
Mm.
conscious and aware of what's going on with them for the day and kind of reverse engineer how do you want to feel and then going back and being like, well, what actions are going to lead to this
Mm.
kind of end state feeling. This is good stuff.
Yeah, I think Larry, you're really making a great point though, too, is that you were kind of in that hole of media. You were just over consuming, you were flooding your nervous system, you were just spiraling. And so, you know what? You had a
Hmm.
chore to do and you distracted yourself physically by doing something and you changed your
State.
environment.
Yeah.
Yeah. So the fact is I see that as a plus because you didn't allow yourself to kind of stay in that media consumption of feeling overwhelmed, which later on you wouldn't have felt good. You would have felt overwhelmed. Maybe you
Yeah.
would have felt sort of depressed or tired
Yeah.
or hopeless or whatever it may be. It allowed you to get into your body and actually do something of action. So that was a great distraction. I would not be so hard on yourself, even though I understand what you're saying is, kind of doing it moving backwards, could I have spent less time on my media consumption, only giving myself maybe 10 minutes or 30 minutes rather than been doing it for however long you were doing it? Could I have made different decisions from the beginning? But tomorrow's another day and you learn from that, right?
Yeah. I think for me, it's whatever I'm going to say 30 minutes a day or whatever it is reading about this stuff and trying to stay up on all the medical whatever happening, like that's it, and then that's it, and trying to,
Mm-hmm.
to have a nice boundary there where I stay away from it, and then I just do other things, even if it is organize my whatever, but yeah,
Mm-hmm.
staying away from that thing.
Yeah.
um let's just check into our Instagram live audience and say hi to them for a second and see. I'm curious if anybody has had any comments or any questions that have come out of this. Hello to our people watching: Peter, Coco, Mina,
Hi, Coco from New
Carlos,
York.
Coco, Clitorally Me, Essential, Michael, Dr. Nadia, Eleanor,
How's things in New York City, Coco?
Irene, Ricky Das, Neves, Sherry. After 9/11, the conversation was counterterrorism. I'm wondering after COVID-19, what will the conversation be?
It's a great question.
I don't know. Do you guys have any other questions or thoughts on what Susie and I have been talking about? Any questions for her that we can, especially around what we've talked about in terms of routines and how this affects generations, and how to help your kids in this time, especially when you're quarantined together, how to get good things out of it? What things have guys been doing that's been a source of fun and joy and kind of positive coping in this time? What what good things have what good things have come out of this? Um, so we'll give that a minute and see if they have any other questions. Susie, let me ask you about so we started talking about kind of some things to do for New Yorkers, people that are in the middle of this.
Hmm.
California, we have not been hit as hard with this up to this point. I was reading some things today. New York has had over 30,000 cases of corona, the most in the country by far. Um, California, on the other hand, I think only has like 3,000 cases. San Francisco only has like 250 cases of this. And
Hmm.
some discussion, is it because it's warmer? Is it because we're social distancing better? Or it really looks like the answer is probably no, we're just a week or two behind, and we're probably
Correct.
still going to get hit by this thing. So, so what would you say to those of us that aren't in it? Is it a different message? Is it still kind of the same stuff in terms of managing fear and stress and all of that?
Yeah, I think what you're talking about is in New York City, there's a density issue that we do not here. We have more spaces where we sort of started from the beginning. So the fear doesn't feel as constant all the time. You're not going to put your garbage down the garbage disposal and go next to someone, which is clearly not 6 feet away in your hallway, and have the same experience as you do in your neighborhood where you're walking down the street, and you can be on the opposite side of the street as someone and still say hi to them and be
Yeah,
part of your neighborhood and their community and get some of that social contact, which is so important in being a good neighbor,
yeah,
that you don't have the same stress levels, that you're constantly sitting in it and your nervous system isn't constantly in hyper alert the way that it is in New York City. I mean, that's why you're seeing a lot of people trying to leave the city, which New York is saying, hey, that's not a good idea. We're just spreading that out even more. Let's kind of just stay put.
yeah,
But tolerating those uncomfortableness and sitting in that for long periods of time is really, really hard on people's nervous systems. Um, so, how is that going to be translating here? That may be a week or two out. We
yeah.
have to just be taking example from the cities that have led successfully in front of us. Is really the only way we can go. You might have a different perspective from the medical community because clearly you're consuming more information that way. So I'd love to hear what you think as well.
Yeah, well, I think the a couple things. One is take it one day at a time. What do we do today? We keep social distancing, you keep staying home, you keep washing your hands and taking care of yourself, getting enough sleep and eating well, and for everybody in California, getting in your best, you know, physical health shape so that if you do get sick, you're the most resilient um, to get through it. But I think also knowing that, like you said, New Yorkers kind of have a faith in their governor Cuomo, and um, has been so much preparation going on in every hospital and all of these health systems. From what do we do if a patient has a cough? What do we do if they have a cough and a fever? What if they have this symptom? And okay, we're going to isolate them in room 3 over here with all the masks. And what happens if we need more rooms and more ICU beds, more ventilators? There's this surge plan that every hospital is thinking about what they can do, anticipating what if it gets bad. Hopefully, it won't be as bad for reasons
Mm-hmm.
like it isn't as densely populated as New York City. That's where it just spread the quickest and ended up there the fastest. Hopefully, we won't get us overwhelmed in that. But if we do see big numbers, what are we going to do? And all of these, healthcare systems and administrators, everybody um, has been thinking about this and kind of maximizing what we can do for weeks. So
Mm-hmm.
knowing that, a lot of people feel unprepared, a lot of people feel overwhelmed, doctors feel overwhelmed, and there's a lot of kind of fantastic stories and stuff in the media, but really every hospital I worked at has spent so much time, so many hours on this preparing, knowing that if it does come, um, we have plans in place to do our best. That this is what we do. I'm
Yeah.
still going to go to work. Like we're not going to quit. Nurses and doctors, we're all going to show up and do our best. If you get sick and you need to come in, that's what we're there for. And I think at the same time, so knowing that we are prepared, we're going to do our best, remembering that this viral season will not last forever. It will come to an end. It'll go up, there'll be a peak, and then after every peak, it'll go down. And you saw this in China, you saw it in Italy, it was bad in Italy. Cases have backed off there. So there will be a peak, it will come down, and it will end, and we will get over it. You know, how bad it is, how many, people die, I don't know, but certainly everybody doing their part with this social distancing will make a difference to minimize it. So know that you can play a part, and what you do matters. So that's what I would say with this thing. And
Yeah.
then just like I feel overwhelmed when I think about doing this for weeks and months, especially as a medical professional. It's not crazy yet for us in California. I'm looking at New York, and I thought about getting on a plane and going out there, but I'm like, settle down,
Yeah.
like down boy, like down boy, like there's going to be time. I work in some places that have a ton of nursing homes, and it's like, God, I hope this thing doesn't go through there, because we could fill up on vents really easily. Like our time to do this will come. But anyway, my point was, I get overwhelmed when I think about a month. Certainly, it's like, what do I got to do today? One day at a time. Like let's sufficient for the day is its own evil, whatever that quote is. But
Hmm.
um, not
And it may even be hour by hour too, or minute by minute, what you're talking about, that it may not be day by day. Um, and I think that's really important to sort of note too. And sort of the call of community. I mean, what you're mentioning is so important, is people feeling purposeful or feeling helpful in what capacity. How can they volunteer? I know Cuomo sent out a note. I'm licensed in New York as well. All mental health professionals that can donate their time in the hospitals because their staffs are overwrought